Did you recently have an ACL reconstruction? Are you thinking about having an ACL reconstruction? Let's talk about a few things that very few medical providers are discussing. First and foremost, we need to understand that having an ACL reconstruction is a big deal. It is a process, not just the surgery, but the post-operative rehabilitation. And we want that process to go smoothly and effectively, and that you have a wonderful, strong, functional knee 6 months, 12 months, 5 years, 10 years, 30 years later. Now, we talk a lot about the importance of getting your knee straight. We talk a lot about the importance of getting quad control. We talk a lot about the importance of following post-operative protocol, particularly things like using your crutch. But the one thing that we rarely talk about is the failure rate and the process that is happening inside of your knee, known as ligamentization. So I'm going to talk to you about those two things because very few people are going to talk to you about those important aspects. First, in the literature, we have seen failure rates reported as high as 24%. Now, I don't believe, based upon my experience, that that is an accurate number. Perhaps the best numbers that I have seen in the literature are on the order of 4, 5, or 6%. But we don't want the graft to fail. Now, why might the graft fail? One of those reasons is that the graft pulls out of the bone tunnel that the surgeon anchors it in. So one of the weakest links in this entire surgical process is the fixation of your graft in the bone tunnels. Now, that might be a quad tendon, it might be a patella tendon, it might be a hamstring graft, and there are different ways that the surgeon will use to try to anchor the graft within the bone tunnel. But we have to be mindful early on after the surgery that we want to minimize the stresses so that the graft does not pull out of the tunnel. Now, the other thing that we almost never talk about, and this is really regretful, and I don't hear many physical therapists or athletic trainers talking about it, and that is the process of ligamentization. When your body takes in the graft, whether that be quad, patella, or hamstring, that tissue undergoes necrosis or cell death. So that tissue is going to die. Your body, through those bone tunnels, are going to bring in revascularization and synovial lining and fluid into that area that is going to promote the healing process. Now, largely, we talk about 3 phases of healing, and you will see slightly different names, and you will certainly see different time periods. But let's talk about 0 to 3 months. Let's talk about 3 months to a year, and then let's talk about after a year. So during that first 3 months is the most critical time because the graft is undergoing this process of necrosis and revascularization so that you can ultimately lay down collagen. So in that early process, it is more about this synovium coming in and about the blood supply coming in and bringing this dead tissue back to life. Then, by bringing in the blood supply, we start to bring in cells. Those are fibroblasts, and fibroblasts are going to lay down collagen. And collagen is the framework. It is the steel girders that are going to hold your ACL together. And it takes time for that collagen to be laid down. And we know through second look surgery, when the surgeon goes back in and looks at the tendon, when you have serial MRIs after surgery and they look at the graft over time, when they've taken biopsies of these grafts, we know that it takes time for that graft to convert from its original structure, which is typically a tendon, into a ligament, and that is the ligamentization process. Now, eventually, well past a year, your graft is going to look more like the native or original ACL, but it is never going to be completely like the original ACL. Now, the good news is that most of these grafts, when they harvest them, they are starting off very, very strong, but they're going to very quickly degrade and undergo this process of necrosis. So the really critical period of time is going to be in that first 3 months, particularly in and around the 6-week mark. The problem with that 6-week mark is at 6 weeks, you are going to start to feel a bit better. You're going to start to feel like you can do some things. You're going to want to push the envelope a little bit, but unfortunately, that might be the time where you should be particularly cautious. Now, very rarely does someone have a traumatic event right after surgery, like slipping in the shower or falling in your driveway. That can happen and you can re-tear your ACL. But the vast majority of these problems are either that the graft pulls out of the tunnel or that the graft stretches out over time because we are overloading that graft. Now, I want to stress, it is really, really important to apply stress to the graft early on, but that stress needs to be controlled, and that stress will tell your body to stimulate growth. It will help promote the laying down of collagen. But if we overstress the graft, we run into the possibility of having a graft that stretches out, and you end up with a knee that is still unstable 6 months, 9 months down the road. Now, we have made some significant progress with biologics and other substances to try to speed up the healing process. There are stem cells using bone marrow and things of that nature to try to hasten or speed up the tissue healing process. And I would suggest that the literature at this point in time is promising, but not certainly definitive. And I would argue that even with this fertilized approach, your body is still going to need time to undergo the processes of tissue healing. Bringing in synovium, bringing in blood, bringing in that cellular matrix that is going to create a strong, stable graft. So my advice is to talk to your therapist, talk to your doctor about the process of ligamentization and utilize the knowledge that we have learned to help guide your rehabilitation. And yes, stress the graft some, but we don't want to overstress the graft. And we have to understand that our body takes time to heal. And we can try to do all the right things to maximize that tissue healing process, like eating well, like potentially fertilizing these grafts, but your body can still only heal at a certain rate. So let's be patient, let's do it right, and let's make sure that when you're 30, 40, 50, 60, you got a good solid knee. Trying to race back to sport may end up causing you more problems down the road. As a 15, 16, 17, 18-year-old, you are thinking about tomorrow, you are thinking about next week, you are thinking about next year. You're probably not thinking about 40 or 50 years of age. We want you to have a knee that is good, solid, and functional for decades to come.